Well, today's video is about the COVID pandemic and how much it's been a challenge for all of us, including our patients and our staff and the larger community. And essentially, we'd like to talk about some common sense measures that we all can take from a public health standpoint to help protect our patients, their families, our staff and their families, as well as our communities. My name is Wael Mourad, and I serve as Chief Health Officer here at Health Partnership Clinic, and we believe that good education of our patients is key to good health. Sure. Well, there are a number of common sense steps that we can take that are consistent with public health guidelines to protect ourselves and everyone around us. I think one of the first things is to wear a mask. So wearing a mask actually prevents a lot of the droplets that come out of our mouths when we speak or when we're in conversation. And so that will help protect others. And by others wearing a mask, that will help protect you. And so that's something that's important to do when leaving the home. Otherwise, it is very important to socially distance. So social distancing includes maintaining a distance of at least 6 feet apart from other individuals that are not your typical household members. The other part of social distancing is avoiding large gatherings if you don't have to. Certainly, if someone has to go to school or has to go to work, that's something that you potentially may not be able to avoid. But attending something, for example, like a football game or a large party or a social gathering that isn't critical is an opportunity to avoid so as to protect yourself and your family as well as your community. Other than that, we always talk about for any viral illness the importance of hand washing. So good hand hygiene is certainly very important to do, especially when you're at home. As we know, it helps prevent the spread of viruses to other members in the household. Now, what if somebody get symptoms? What if somebody starts to get sick or they feel like they're getting COVID? In that case, it's very important to self-isolate. So self-isolation means that you do not go outdoors and you stay in a place where you are minimizing contact with other household members because we're in the middle of a pandemic, it's quite possible that your sickness may be because of COVID. So to self-isolate at home when you feel like you're developing symptoms is important, and then to call your doctor. Most doctors' offices nowadays offer telemedicine so that you don't have to actually leave your home in order to get medical care. Now, the other thing to consider is, well, what if I'm not sick, but I was exposed to someone? In that situation, we recommend what's called quarantining. And so there's a difference between quarantining and self-isolation. Self-isolation is if you feel like you're sick or you're starting to get symptoms. And you can remember that being sick means you have to self-isolate because they both start with an S. So when you're sick, you need to self-isolate. If you're not sick, but you've been exposed to someone who was diagnosed with COVID, then you need to do what's called quarantining. Quarantining is very similar to self-isolation. It essentially refers to the need to stay at home. So we would not go outdoors unless it were something absolutely critical. And so that would be a reason not to go to work. That would be a reason to have a telemedicine appointment with your doctor's office, for example. So quarantining is an important way to help minimize spread to the larger community, because while you may not be having symptoms, it's possible that your exposure to COVID may have led you to acquiring the COVID virus, but it just hasn't shown up yet. And the quarantine period is to actually give it a good period of time to make sure that you don't have symptoms and to make sure that you are actually okay to leave the home after the quarantining period is finished. Lastly, what we would emphasize or recommend is to get a COVID vaccine if it is accessible to you. The thing about the COVID vaccine is that it prevents those who have gotten COVID from getting very sick. So even if someone did get COVID and you've been vaccinated, the vaccine will help prevent that infection from getting sick enough where you need to go to the hospital or become hospitalized even. So as a last sort of line of defense, in addition to all the other public health measures we talked about, vaccinating is something that's very important. So a common question that comes up with our patients is, I had symptoms and I was diagnosed with COVID, now what? And so the Centers for Disease Control and Prevention, as well as the Kansas Department of Health and the Environment, have regularly put out updated guidelines to help us guide our patients. So the number one thing to remember is that if you've been diagnosed with COVID because of your symptoms, is that you have to self-isolate at home. So then the question comes up is, well, how long do I self-isolate for? So based on the most recent guidelines that we have available, we recommend to our patients to self-isolate for a period of 10 days. The first day is the start of your symptoms. And so it's important to self-isolate for 10 days after the start of your symptoms. But it may not end there. Not only do you have to self-isolate for a minimum of 10 days, but you also have to have gone through a period of at least 72 hours of being fever-free and having a significant improvement in your symptoms. So we have to meet both of those criteria. At least 10 days from the start of your symptoms, and to be symptom-free for at least 72 hours, or at least much better in your symptoms and fever-free for at least 72 hours. And so another question that comes up is, okay, well, I was advised that I have to quarantine based on exposure to a COVID-19 case. Now what? And so in that situation, the most important thing to remember is that you have to quarantine at home. So you would not go to work, you would not go out unless you absolutely have to, and in which case you would wear a mask. And so as far as how long you have to quarantine for, basically, what we recommend is you must quarantine for at least 10 days from the time of your exposure. And so for a lot of our patients, they say, well, 10 days, I don't know if I can quarantine for 10 days because I really have to get back to work. And so the guidance we have on that is that you can break out of quarantine a little bit earlier with testing. And so if you get a PCR COVID-19 test on day 5 after your exposure, and that test comes back negative, then you would need to quarantine for only 7 days before you can exit quarantine. Now, if at any time you develop symptoms, then it becomes a different story, and it would be important then to get tested as you may have COVID. Now, these are general guidelines that we recommend to our patients. And a lot of times there are special circumstances that may require some differences in management from case to case. And so for that reason, while these are general guidelines, we recommend that you always talk to your doctor so that you can get definitive recommendations from him or her, and to take guidance from your place of work as far as when you are safe to go back to work. And most places of work will require a doctor's note, and your workplace may do their own evaluation as well. So it's important to work closely with them so that you get the best guidance for you.